At Children's, we believe every child should have the opportunity to laugh, play, and enjoy a full life. This is why our employees work so hard to create a safe and healing environment for our patients so they can get back to doing what kids do best, being kids. However, we can always do better, and for the sake of the children we serve, we need to do better. This is why patient safety is our top priority. We use the IHI's No Needless list as our guiding principle. 0 is our goal. 0 needless deaths, 0 needless pain, 0 helplessness, and 0 waste. Our quality leadership team, physicians, and staff work together to develop and create innovative and best practices for patient safety here at Children's and across the pediatric continuum.
Children's asks employees to focus on a few key areas: prevent, protect, and partner. As part of our prevention efforts, the employees at Children's promise to assess for risk of falls, do the 5 rights of medication administration, identify the patient, prevent an event, use pews, and prevent pressure ulcers.
On average, Children's dispenses more than 8,100 doses a day to our patients. That's why it is so important that nursing and pharmacy work together to get the right drug to the right patient at the right time.
Through the use of technology, such as electronic medical records, Pyxis, and smart pumps, we are able to put safety measures at the nurse's fingertips at the point of medication administration for the patient. We are also fortunate here at Children's to have pharmacists available in patient care areas to assist the nurses with medication reconciliation at admission through their stay until discharge with discharge counseling.
Implementing the assessment tool Pews for every patient system-wide is an important quality initiative at Children's.
The Pews stands for Pediatric Early Warning Score. Children's was an early adopter of this scoring system, spreading it throughout all 3 of our campuses on every unit. The Pews takes 4 components of the patient's routine assessment and pulls them out of the routine assessment, putting them in their own category to paint a picture of deterioration. Those 4 components are the child's respiratory status, cardiovascular status, neurologic status, and whether or not we're needing to do frequent interventions to maintain stability. The Pediatric Early Warning Score is helping transform the world of pediatrics. What we're finding is that patients don't deteriorate suddenly, as we've always believed in pediatrics. The patients are giving us a 6 to 8 hour window of warning that something's not right. Remember, just because they're playing their video games and eating their popsicles doesn't mean that they're not deteriorating. The nurses are telling us that the Pews helps give them some kind of data to go with that gut feeling that they're having. And the physicians are telling us that the Pews gives the physician and the nurses a common language with which to speak about the patient.
Employees at Children's also protect patients in the following ways: do time out for those invasive procedures that need site verification, foam up, speak up, use SBAR, a communications process that covers situation, background, assessment, and recommendation in every transfer of care. Follow high alert process when it comes to high alert medications, and reporting all concerns.
Foam Up is our current hand hygiene program and campaign here at Children's Healthcare of Atlanta. It is very unique in that it encompassed many stakeholders across the organization to include physicians, leaders, care level staff, internal and external communications, human resources, media and marketing, and most importantly, patients and family members. We have built some very unique boxes that can travel from one nursing unit to another, where we use black lights and a special fake bacteria to put on children's, families, and clinicians' hands and test their ability to wash their hands correctly. We've made it easy to perform hand hygiene at Children's Healthcare of Atlanta. We have installed over 3,000 alcohol foam dispensers across our system, in addition to all of the sinks and soaps that we currently had. We always look for opportunities of where we can place these products to make it easy to do the right thing. Hand hygiene is a component of all infection prevention, primarily with regards to bloodstream infections, surgical site infections, and ventilator-associated pneumonias. We have been able to significantly reduce our rates in all 3 of these infection prevention initiatives through the improvement of hand hygiene across our system.
Part of the quality process at Children's involved partnering with each other, with patient family members, and with other areas of Children's and the pediatric community to develop systems in place that improve our patient outcomes. These include addressing patient pain, doing the transfer of care process, being a patient advocate, involving the family, calling rapid response teams, and using TLC, or touch, look, and call when checking IVs.
Transfer of care is an important component of our quality initiative that requires flawless communication amongst all caregivers along the entire transfer process. Representatives across Children's has developed a list of the 26 most important items used when transferring patient care utilizing the SBAR approach.
Another initiative we put in place to improve our patient safety is our rapid response team. The nurse may call this team at any time that they are concerned about the deterioration of the patient. The team is comprised of a critical care nurse and respiratory care professional with access to a physician.
Although we continue to make significant strides in patient safety over the past few years, we still have a significant ways to go. We need to continue to focus on accountability and transparency.
Our completely implemented electronic medical record will continue to be an important part of our approach to patient safety and a critical component of the way we hardwire the ways we improve patient care.
Additionally, Children's will focus on family-centered care, continuing to partner with patient families to improve communication and to work with the families to help identify problems.
Our staff continues to understand the changes they are implementing do make a difference in our patients' lives.
They're the ones that hold each other accountable. They're the ones that follow the processes. They're the ones that come up with the solutions.
Since adopting the Institute for Healthcare Improvement's No Needless list, Children's has prevented 319 bloodstream infections, saving 80 lives, decreased serious medication errors by 50%, prevented 9 surgical site infections from shunt surgeries, decreased turnaround time in the emergency departments by 26 minutes, decreased serious events by 77%, and decreased codes outside the critical care units by 78%.
Although we've come a long way, we still have work to do. Our aim is zero.
Zero needless deaths.
Zero needless pain and suffering.
Zero needless helplessness.
Zero unwanted waiting.
Zero waste.
Because even one is not zero.
And because every child
Every child
deserves another day to shine.